Hi, I'm Bob Seidenberg, a longtime journalist in Evanston, and today this is a Facebook Live session conversation about the coronavirus and Evanston's response, and we have two people that are right in the forefront of that with me. Mayor Stephen Hagerty.
Nice to be with you.
Thank you very much for arranging this. And Ike Ogbo, Director of Health and Human Services. Thank you. And quite an auspicious time. Mayor, you sent out, I felt, a very kind of telling, detailed kind of message yesterday entitled Flattening the Curve, in terms of a strategy that the city has adopted here in response to the virus. Can you talk about it a little bit?
Sure. And thank you, Bob, for doing this. And for those that are watching this, I want everybody to know, Bob is not an agent of the city. Bob is a reporter for the Evanston Roundtable, has been for a long time. Free to ask us any questions that you have. We want to share, and I want to share, and Ike in the city, all the information that we have that's available out there. There may be certain questions that people ask that we can't share that information because of HIPAA laws and all of that. But we want people to have a better understanding. There's only so much you can do in a message, and we did. I spent a lot of time. I personally, drafted that message. People from the city, Ike, other people helped and worked on that. And I know that there's a lot of fear. There's a lot of uncertainty out there about this virus. It's new for all of us. It's rapidly evolving. And what I wanted to get across in that message last night is the strategy that not just Evanston's adopting, but that the nation is adopting. Mm-hmm. And I didn't write this into the message, but just so people are clear, and I've been on lots of conference calls with the White House and all these federal agencies, to the governor's office, which I was just on with Erica Storley, our acting city manager, literally an hour and a half ago, with Governor Pritzker and a bunch of mayors and others from the city. What I want people to, or from the state, what I want people to understand is that there are different strategies that could be adopted, okay? Mm-hmm. And to my knowledge from all of these calls, there's really three strategies. And those strategies are option A, let it run its course. And if we let this virus run its course, we know that our healthcare system is going to break down, and more people, the most vulnerable people to this virus, which are our older residents as well as people with compromised immune systems, are going to be most vulnerable, and more people are going to die. And that's option A. Option B is flatten the curve, slow the spread. And that's what we have adopted as a country, what we have adopted as a community here in Evanston, and are encouraging everyone to, comply with that. And I can go into some of the details of that. And then option 3 is a complete lockdown of your country, of your community. Everyone shelters in place, and we let basically time evolve to hopefully drive this virus away, and it becomes dormant. Those are your choices, as far as I can tell from being on these calls. And the nation right now is going with flatten the curve, slow the spread. And you'll hear me talk about that more, and Ike talk about that more this morning.
The science behind flatten the curve, Ike, it's based on a timetable, correct? And projections or...
Yeah, it's pretty much based on what I would classify as projections. For right now, we do not have a timeline by which we know that the virus will cease transmitting in our communities. When we first heard about coronavirus, and this was a couple of months ago, in China where it originated from, CDC sprang into action to contain the virus. But we are no longer in the containment phase. We are now in what I would classify as the mitigation phase, where we're trying to slow down the transmission so that we can have some other interventions, maybe some medical measures. As you probably know, there are no vaccines nor antiviral drugs that one can take to combat the virus. We are hoping that in the near future, that we will have a vaccine to do it. But in the meantime, we have to figure out ways in which to convey messages to our community, of which I think we've done a tremendous work at, of how they can protect themselves and prevent any type of transmission. And when we talk about methods one can use, we talk about non-pharmaceutical interventions, things like washing your hands constantly, or when you visit the toilet, or when you handle something that is contaminated or dirty, using sanitizers as well that has 60 to 95% sanitizer, coughing into a tissue and disposing that, and importantly, staying home when you are not feeling well. And given that we have our most vulnerable populations, like our elderly, affected by this virus, avoiding crowds is one of them as well, in which one can prevent or protect him or herself from the virus. So all these methods and all these measures that you put in place results in what Mayor Hagerty was emphasizing, flattening the curve. What that does is buy us time so that we don't overwhelm our public health systems and our hospitals, because they need to also catch up. Right. So that's pretty much what it emphasizes, in my opinion.
Can I just add one thing to that?
Sure. Mm-hmm.
So this whole idea of biding our time is critically important, not just for the healthcare system itself, so they don't have this huge surge and they can't handle it, and that breaks down, but also because, and everybody knows this and has read the papers, we have not done as a country a good job getting the tests, kits that we need, okay? And there was a problem, and we could sit here and we could argue about the bad decision that was made and everything else, but it is what it is. So part of this biding our time and slowing this down is also to allow the supply chain, the medical supply chain I'm talking about, to sort of catch up to where we need it to be to treat people. It also is to elongate that as long as possible so that we can hopefully 12 months from now, have a vaccine and start to vaccinate people in this country.
And Mayor, along with your message yesterday, you made some tough decisions in terms of major events, and we're seeing other groups kind of align with that in terms of postponing events and not creating additional pressures. Can you talk about that? And
let's just start with, this is an unpleasant experience for everybody. All right, there are no easy decisions that are going to be made. I think the decisions that we made with two bigger events that we were going to have this weekend. One was the State of the City address, which was to happen literally just around this time that we're having this conversation, that we postponed. And then the second is the big celebration we're going to have of the facility, the new facility of Crown, that a lot of people have worked hard on. And we postponed that. Both of those, in my opinion, are non-essential. Okay, tougher decisions, and a tough decision that was made last night was by our school districts, District 65, District 202, which is ETHS, along with a consortium of schools all along the North Shore, who made a really tough decision to say, you know what, we are going to move into e-learning. Okay, and so starting Monday, they'll start to go into e-learning. These decisions are going to be painful for a lot of people. They're not easy. I would just ask people to realize it's hard to know exactly what the right answer is. We've explained the strategy. That's the strategy that we're working towards, and hopefully we're going to slow the spread.
And Ike, I mean, a lot of groups, smaller groups, different groups are going to have questions too. And, in terms of, criteria, all kinds of events. Are you fielding calls? Is there a centralized way of somehow,
So what we've done in response to the coronavirus situation is assemble a response team. So the calls are coming through our team, and we are trying as much as possible to, of course, respond to the inquiries and the questions that they have. We have done a tremendous work at reaching out to pretty much all the groups here in Evanston, our long-term care facilities, our homeless shelters, daycares, our business owners as well, where we have tailored information to the population that they serve, so that they can follow guidelines to protect themselves.
Is there
Yes.
like a rule of thumb,
So right now, the virus is a new virus. There's still a lot to learn from this virus. This virus belongs to a group of viruses called coronaviruses, and with those viruses you have SARS and MERS. SARS is a disease in 2003 that was here in the United States and a number of other countries, and of course MERS. So the way that we are responding to this virus is the way we responded before. So we're pretty much taking a template on how we responded to those viruses prior and applying it to this particular situation that we have, because it tailors or it has the same features as those other viruses. So that's how we are moving. And there really isn't much known about this virus, and as I stated, we are still learning the virus. The experts are still doing their research, and in order for one to attack a virus, you need to know its characteristics, you need to know its clinical profile, you need to know what the resulting illnesses or symptoms will be, and if there are any medical measures that you can take with this virus. So currently they're still doing the research, but the recommendations that we put in place I think are very useful and very beneficial to slow down the virus and for people not to get this virus and for people to stay healthy.
And and it was pointed out too, there's groups that are they're particularly vulnerable,
Right,
and I know you've been reaching out to them.
Right. Mm-hmm. Absolutely. Yeah, we've reached out to our long-term care facility. The way that the virus and the disease is designed, it is affecting our most vulnerable populations, which of course are elderly. And not only that, people who are, younger, but have some health complications as well. So our focus is to ensure that the right information is provided to our long-term care facilities so that they can protect themselves, certainly.
I'll just add, so on the conference call with the governor's office, and Dr. Ecclesi, who's the state public health director, was on the call as well, and they said 80% of the people that are getting COVID-19 are making a full recovery and not too many complications. Okay, I'm sure it's discomfort and all of that. 20% are having much more severe complications.
Okay.
And so again, slowing the spread, flattening the curve is so we have enough healthcare resources to help those 20% that get it. I'd also like to add, when we think about the medical profession, we often think about the clinicians, the doctors, the nurses that help us when we break our leg or need a kidney taken out or whatever it may be. I think as we go through this, we're going to develop a great appreciation for people like Ogbo and everybody that is in public health. Public health, again, is looking at the entire disease itself and saying, how do we address this? Great example of what public health people do is they look and say, well, cigarettes, those actually cause cancer, and what can we do to get people to smoke less cigarettes? That's why social distancing, good hygiene, all of that is coming out of the public health community, and all of the sort of direction that we are taking as a community and as leaders in the community is coming out of these public health departments. It's not your mayor, right, making this stuff up and saying, okay, social distancing is what we're going to do. And there's a real science to it, and they're looking at data and what's happening in other countries that's effective and trying to apply that here in the United States.
Sure. Let me move to some of the questions because, not surprisingly, Evanston residents, really plenty of questions. And as usual, much better than mine.
Right. And can I just say, I have no idea what these questions are. If we know the answer to the question, we'll give the answer to the question. If we don't know the answer to the question, we'll say we don't know. And if something's covered by privacy laws and things like that, we'll tell people that.
Yeah, when you walked in here, I was surprised. You just saw it and didn't want to.
No, I didn't.
Well, here we go. This is from Claudia. Is it true that there's a shortage of COVID-19 tests?
Mm-hmm. So let me start off because we talked about this on the call with the governor's office. Yes, There's a shortage of tests, and you have two issues with the tests. One is we need to get enough test kits out there to all of these different communities, okay, across the United States. I do believe from a conference call I was on earlier this week with the White House, like they are working around the clock on this with manufacturers and everybody. So that's the first thing, is we've got to have all the test kits, and there is a shortage of test kits. Second thing is the actual testing centers themselves. Right? I think there are, and I can give the exact number here in Illinois that we have, but those centers can only process so many tests. Okay, so we need more centers to come online. They did just say that, I think it's called Quest Diagnostic is now starting to process tests. So we are going to have literally, tens of thousands, hundreds of thousands of tests that are going to be run. We need to get that up and running too. This gets back to, again, what I talked about earlier, slowing the spread, is so we can bide time for this type of supply chain that we need to get up and running.
Did you want to add to that?
Actually, they are, just to piggyback on what the mayor stated, they are 3 certified state labs that we have in Illinois, 1 in Chicago, 1 in Springfield, and 1 in Carbondale. And most recently, they added LabCorp to that list, and that's actually a private commercial lab that can conduct these tests. Also, most recently as well, they've added Quest Laboratories, as the mayor indicated, and another lab called Arab. So I'm hoping that these upcoming weeks there will be more commercial laboratories that are approved by the state that can conduct these tests. So when we first heard about this virus and we sprang into action, there were limited labs, and I am proud of what Illinois did. Illinois was one of the first states where they confirmed that we can actually start testing. So that was extended to the other labs that we have in the state, which are Springfield and Carbondale. So I think the more avenues, the more places people can test, it would give us a picture of the community spread of this virus, and that's if there's any in a specified community. So I'm hoping that in these upcoming weeks we will have more information from the state about more commercial labs that will be added to the ones that we already have.
Lucy asked, what is the city doing to help marginalized families with childcare and meals while schools are shut down?
Okay, great question, Lucy. Thank you. So once the schools made the decision last night to shut down, we have certainly been working quickly with the schools. There was a meeting this morning. The city manager, the superintendents were on. I joined that meeting, and a press release may have just gone out. So I want people that are watching this to know we did just institute school lunches and breakfasts will be served, even though schools have gone into e-learning. That is going to start this Monday, this coming Monday. I brought a paper here so I could get all the details. It's open, so this is a cold breakfast and lunch serving youth 1 to 18 years of age. There's no residency or income-based restrictions to participate in this program. Free meals are available to all youth in this community. Meals will be grab and go. They're not going to be meals that are eaten on site. Again, This gets back to sort of social distancing. The meals can be picked up from 11 a.m. to 1 p.m. at the following 4 locations. Fleetwood Jourdain Community Center, which is at 1665 Foster Street. Right. Robert Crown Community Center, this is the new Robert Crown at 1801 Main Street. Cayman Park East Fieldhouse, which is at 1115 South Boulevard. And then Mason Park, which is at Church Street and Florence Avenue. And youth can pick up both meals at the same time. They can get their lunch for that day, and then they'll get their breakfast for the following day. So, Lucy, we do share the concern that you and many other people have expressed to myself and lots of aldermen and other people in the city about what are we doing to help families, particularly those where food was essential, that they got through the schools, where childcare is essential, and we don't have any. I'll tell you right now, we don't have an answer for that question right now. I know a lot of businesses are also trying to move into teleworking. That may work great if you have a high school kid. It's a little harder when you've got a third grader, and you're trying to work from home. I mentioned at the beginning the unpleasantness of all of this. This is one great example. I will say this. Right now, we don't know all the problems and we don't have all the solutions. We don't, know all the problems, don't have all the solutions. People can really help, and I'm seeing it on social media. I'm seeing it in emails. So please, if you see a need and you think, we're not stepping up, or there's a problem here and we need to, send an email to me or to our city manager or to your alderman and express that. And when enough people do on certain things, people go, oh, wait, there is a problem here. We've got to work to solve it. Again, this is all happening very, very rapidly, and we're going to do our best to try and help those families in most need in our community, while also, again, protecting our most vulnerable population to this virus, which is people over 60 years of age and those with compromised immune systems.
And I was just thinking too, but how about people under psychological stress? Are you picking up anything on that? And is there something available to them? Because
of course, with this virus and this situation, there's a lot of anxiety, fear, apprehension in the community, and it definitely affects people's mental health, and we understand that. And my message would be, if you're experiencing being overwhelmed, issues, depression, because this actually can cause all of these things, stress, seek help. This is one of those situations where even uncertainty can cause stress, can cause mental health issues, because you don't know if there's light at the end of the tunnel. But what we continue to relay to the public is to ensure that you put measures in place, and these are the NPIs, the non-pharmaceutical interventions that one can take in order to protect that person and the family. Also, another thing that we are encouraging people to do is to reach out to loved ones, talk to people over the phone. Sure. There's some individuals in which will meet what we call isolation measures or isolation orders, where they're supposed to stay in home because they have contracted the disease. I mean, it can be a lonely place. What we're encouraging people is to reach out to your loved ones, talk to people over the phone, Skype, video, chat with individuals, and I think that will go a long way in making one feel better. And another thing that we've been sending as well is stigma. There has been some cases and situations where people have been stigmatized because of where they're from or where they've been. And the message that we're sending into the community is saying, speak out against negative comments. Be mindful of what you post on social media. Be supportive of individuals who are in isolation or who've been quarantined. And I think if we take all these measures and if we take all these approaches, we'll be able, to make a good change. Because this is a big situation, and not a lot of people are taking it really well. So.
Can I just put a plug in for Neighbors Helping Neighbors?
Yes.
I talked a lot about family and all of that. There's many people that live in this community that don't have family. If you have, an elderly neighbor, check in with them. If they're concerned, about going to the grocery store, maybe you say, hey, let me go. I'm going to the grocery store. Let me run and pick up some things for you. A lot of people are, again, emailing saying, what can I do? I want to help. There are lots of things. I'll continue to try to post things on my Facebook page as I have time about things that come across my desk that I think people can do to help. One of those just came across my desk, and I just put it up on my Mayor Steve Hagerty Facebook page, which was there's an urgent call coming out from the Red Cross for blood donations. And again, I don't think that blood donation call is related to COVID-19 per se, but a lot of people are fearful of giving blood. And remember, life still goes on. There are people that need blood transfusions and everything else. So if you're someone that's eligible to give blood, that's something that a personal action you can take that would be very helpful right now.
Okay, Cheryl asks, despite extra cleaning efforts instituted by businesses, is it really safe to go to health clubs or restaurants?
Good question. So right now, according to CDC and according to the Illinois Department of Public Health specifically, there is still a low chance of people getting the virus. But I keep re-emphasizing the need for MPIs, and disinfecting surfaces is part of them. Where we disinfect surfaces, the counters, gym equipment, club equipment, phones, doorknobs. That's very, very essential in preventing the transmission of the disease. Currently, I would say there is no risk for individuals to go to restaurants, but we also have to be mindful of large gatherings or maybe food festivals where people will be maybe in confined spaces. That social distancing is very important. But we are not discouraging people from going to dine, but what we emphasize and we also sent guidelines to our restaurant owners of what they need to implement and provide strategies on how to clean, of how to tell people to stay home if they are sick. So I think if we employ all these strategies and methods, we'll be able to slow down the virus as we've continued to talk about and prevent people from getting sick.
And part of that is social distancing
Absolutely.
at these restaurants too.
Absolutely.
Can you just share with people
Absolutely.
sort of what the CDC guidelines are on that? Because
Absolutely.
people I think are getting familiar with a word we weren't a
Right,
week ago,
yes,
social
yes.
distancing, and what does
Right,
that
right.
mean?
So the disease is transmitted by respiratory droplets. So if someone sneezes or coughs, these droplets, they make it to your nose or your oral cavity. If they make it to your lungs, this particular virus is shaped like a tennis ball, and it has spikes on it. And when it lodges onto your lung, what it does is replicate itself, and that's why you have the symptom of people, being it being difficult
Right.
for them to breathe and
Right.
what have you. So if you are able to maintain a certain distance of 6 feet, that's what CDC is recommending, the chances of that virus reaching you is slim, or it won't reach you at all. So that's what we have been emphasizing, that's what we've been preaching, social distancing. And like you mentioned, Mayor, not a lot of people know what that means. According to CDC, it means staying away by six feet of an individual who is sick or who is coughing or who has symptoms that might be reminiscent of the coronavirus.
Can I add one point here that I think
Yes.
is really important for the viewers of this at this point, because we haven't talked about it. I want people to know at this point in time, we have not had
Good.
a known,
Good.
Yes.
confirmed case of
Right.
COVID-19 of an Evanston resident.
Right.
Okay, and that was in my
Yes.
email or my message last night to the community. I did get a couple emails back, and they said, "Mayor, you're not telling the truth. We have," and this was in my second paragraph of the message, and maybe in case anyone missed it, there is North Shore Health System, okay, which serves this wider area, not just Evanston, but this wider area, has taken in a patient, confirmed patient with COVID-19. That confirmed patient lived in the surrounding area, not in Evanston, hence the statement I just made, but is a member or had attended services at the Unitarian Church
right.
here in Evanston. And so I want everybody to know that, because that's everything that we know. So if you're like, oh, I've heard there's other cases, you've got the health department director here who's the most up to date, and then I'm probably pretty close behind him. But what I want people, and I'd like you to talk to Ike, is once you have a situation like that, can you talk about contact tracing and what your office in your department, and explain to people how big your department is, the fact that we're one of few that have it, and take us through the process.
Absolutely. So our department is a certified health department. It is one of the certified municipal health departments in Illinois, and is actually the oldest health department. So we have some legacy there, and we have some history there. So when someone is confirmed to have a case, we are notified by the Illinois Department of Public Health. We talk regularly with our local hospitals, where they of course provide us information, and they also seek our guidance if someone qualifies as what we call PUI. That means a person on investigation. This person might be exhibiting symptoms of of respiratory distress or disease, or this person might have traveled to a region where there is heightened coronaviral activity. So when an individual has been presented with a case, we are made known, And what we do is we contact this individual. If this individual is hospitalized, that's a different story. We contact people whom we think by our investigations have some type of direct contact with a person who has been confirmed with the disease. And we make that contact, we do our assessments, we do our investigations to determine the degree of exposure. And once that's made, what we do is tell that person you need to isolate yourself. Because what we're trying to do here is, of course, debar the spread of the virus in the community. And what we do is we monitor this individual. We do have some devices where this individual will have to log in, what their symptoms are, or if they have any or they don't have any symptoms at all. And this individual is to be isolated for 14 days. So we monitor this individual on a daily basis, actually twice every day, to see what this person's symptoms are. And after those 14 days, if there are no symptoms developed, that person is free to go. So that's actually what we do, and we continue to do. We're monitoring the situation, and we take our guidelines from, of course, the Illinois Department of Public Health as we're conducting these assessments. And there are a lot of variables when you're conducting these assessments and investigations. And when it gets to some of the variables or some of the very sticky ones, we also seek advice from the Illinois Department of Public Health to guide us through some of those situations.
So just for the viewers, that people know, this is called contact tracing.
Yeah, contact tracing.
So this
yes.
is called contact tracing, and one of the other elements that was in the message that we put out was on the medical response core. And again, when people are saying, what can I do, like that's something they could do if they want to get involved. Could you talk about
Absolutely.
that? Because contact tracing sounds fine.
Right.
When you have 1 or maybe 5 or 10 cases.
Right.
What if you have 100 cases? What if you have 1,000
Absolutely.
cases?
Absolutely.
How do you possibly do this?
Absolutely. So we have what we call the Medical Reserve Corps. And these are professionals. These are people who are medically or public health inclined. So what happens is, and what we did was, send a message to them and say, okay, in a situation where we get a case, we will need your help. And we got tremendous response by people who want to help in a case when we have 100 people that we have to investigate. And as you know, our department is a small department, and we might not be able to handle all the capacity. So we rely on our MRCs to help us in situations like this. And like I mentioned, these are medically inclined individuals, some of them nurses, epidemiologists, professors, medical doctors who can definitely help us out. And like I mentioned, we got a tremendous response, which I'm very, very happy about. In our MRCs, we have a tune of about 40 to 45 individuals who can help us out, which is excellent. I think.
But you're looking generally for people that have some kind of health or medical experience.
That helps, but anyone can help.
Okay.
I mean, when it comes to an emergency, we require all hands on deck, especially in a situation where people are tied up. People have numerous tasks that they are performing. So if you're not even in the medical field, there's a way in which you can help us. Definitely, there's a way in which you can help us. But the Medical Reserve Corps are just for those who, yeah.
All right, Bob, I'll stop asking the questions. To the question
Very
that you did ask, though, from the woman about restaurants and the health club.
Yeah.
I think it's a great question. I'm asking the same question myself. And what I would say is, again, leaders of different organizations, including the leader of your health club and restaurants, need to be, acting prudently, sticking with this strategy. Right. And for any of us that are customers or clients of those places, to ask them and tell them what we want is absolutely appropriate.
Sure.
This is from Tom. Where can residents go to be tested for COVID-19?
Absolutely.
You sort of covered
I sort of covered it. So talk to your physician. Your physician will do an assessment or analysis and determine whether a test is necessary. So that person will have to call their physician.
But I would just say everything that I have heard on these calls and everything else is, you got a minor cough, you've got a sore throat,
Right.
anything like that, please don't unless you really have the symptoms, and
Right.
maybe you could explain
Absolutely.
the symptoms
Absolutely.
to people, the real symptoms of this.
Right.
It's best to not drain our healthcare system
Absolutely.
right now and use prudence.
And as I mentioned, contact your clinician. Your clinician will make the determination whether a test is needed is actually one of the criteria. And another of the criteria which the mayor kind of highlighted on is if you are of a high-risk population and you are, of course, exhibiting severe symptoms of the disease, you are a candidate for testing. And of course, if you've been to any of the regions where there's heightened coronavirus activity, it is also recommended that you talk to your physician where a test will be taken and the test will be sent to the lab, and of course, eventually we'll get the results of that test. So these are the criteria one will pretty much will have to meet in order to qualify for testing at this point.
But there is frustration out there. I have somebody in my own company who's a teenager, not here in Evanston, a different part of the country, very, very upset that despite what seem to be severe things and a request from the doctor, still can't get the test.
Right.
And so again, if you're saying to yourself, well, what can I do? Sending a note to, your senator, sending a note to your Congress member, and putting the pressure on and just making sure that pressure remains, that, Americans are upset and we need this to happen. We need these test kits.
And just briefly, Mayor, you also pointed out, take care of your flu test and stuff
Absolutely.
like that, because immunity is so important at this time.
It's a really good point. If you haven't gotten your flu shot yet, even though it's late in the season, go get your flu shot. Flu shot's not going to protect you against COVID-19, but it is going to, again, relieve the healthcare system if you did get the flu and you needed to go there. So we all need to act prudently.
Catherine asks, will the city be sponsoring any public assistance programs for small businesses who have been affected by the quarantines?
Yeah, so great question. We are all worried about the impact that this is going to have on our local economy, on the national economy. We're already seeing it with the stock market, up and down. But the stock market's one thing. It's another thing if all of a sudden you're a local business and your revenue is down $50,000 this month and you have to lay off people. I met with the hotel owners here in Evanston yesterday. This is a real concern. These hotels are already practically empty. Northwestern has made the decisions they thought best for their campus and their students, and they bring a lot of business here to Evanston. So and I'm talking to our senators' offices about different federal aid programs that we'd like to see turned on. And one of those would be the Small Business Administration's disaster loan program or disaster economic injury kind of program. The president talked about this, made reference to it the other night, but there's a lot of federal aid. The big question for Washington is whether they would declare a presidential disaster for the entire country. We're used to presidential disaster being declared when we have a disaster like 9/11. Again, it's sort of in one geographic location, or for, Hurricane Harvey down in Texas, in Louisiana. But to have it declared for the entire country, you are talking about, potentially, $100 billion or more. It would just be for all the emergency response costs that are being incurred by everyone. But again, to the extent that you're practicing social distancing and all that, please, do, go to restaurants here and try to support, business owners around here. We're all going to have to weather this, and it's not going to be pretty.
Kim asks, will city parks remain open? Will there be guidelines for park usage?
So I haven't, Kim, this is one I haven't heard otherwise. Okay, in terms of parks themselves, I haven't also heard otherwise in terms of any city facilities. So again, you take the Crown Center or Fleetwood, Jourdain, so I have not heard that anything on that. I do. What's that? Okay, so the city manager, just so people watching from home, the city manager sitting in this conversation, she just told me that the city is evaluating, the actual facilities themselves. But for your kid to go out and toss a ball around in a park and all of that, on a beautiful day like it is today, is fine. Unless they're showing any kind of symptoms of being sick, then they should be home and self-isolating.
Right. If a person, this is from Ruth, if a person gets COVID-19 and recovers, will they be immune so they can take care of others?
So, like I stated previously, there's just a lot not known about this virus.
Right.
The experts are working day and night trying to figure this virus out and its virulence and its potency, how it transmits and how it operates and functions. So as information reaches us, that will be something that we will share with the public. But it's just something that they're currently studying, even immunity as well. So CDC, Illinois Department of Public Health, they are still not fully aware of how this virus, its characteristics, its virulence, and its potency. So it's still being figured out.
This is from Ann. What are local hospitals doing to increase the number of available beds?
So what I can tell you from the call that I just got off with the governor's office, and people have seen this on TV when they're watching like South Korea's response, they are starting to test mobile centers, mobile health centers, so people eventually, again, when we have enough test kits and the people that need to be tested, again, we all need to be aware that it's the people that most need to be tested when we have a limited supply right now that we're trying to get tested, that they will have sort of either separate sections of the hospital or a tented facility nearby where people drive up and do that.
Liz asks, what makes this pandemic different from those? I didn't pronounce that right?
From
those in the past.
Those in the past.
And she names SARS.
H1N1.
All right.
Right, H1.
So SARS pretty much began the same way coronavirus began, where there was apprehension, fear, anxiety, because it was a new virus, and SARS had the same symptoms, so to speak, with coronavirus, and it still belongs in the family of coronavirus. So one of the differences is SARS didn't expand to as many countries as coronavirus has expanded to. So we are talking about in the tune of over 100 countries where we have coronavirus. In comparison to SARS, we're talking about maybe 25 countries, including the United States, where you had SARS. And SARS originated from Asia, the same way that coronavirus originated from Asia, China specifically. So there's some similarities. There's some similarities there. But what happened with SARS is that it was contained quite swiftly, I would say. And there has not been any cases of SARS since 2004, really? Anywhere in the world. And when you talk about H1N1, there was a light at the end of the tunnel in which there was a vaccine that was produced within 6 to 7 months to vaccinate individuals, which with this virus, we do not have any vaccines to eradicate or for us to administer people with. So you can see actually the differences there. But with coronavirus, it seemed to be a situation that has affected the entire world. Just a couple of days ago, the World Health Organization announced a pandemic for coronavirus because of the regions in which it has touched. So you can see that the impact of this virus, and like I mentioned, the experts are currently working on this to figure out vaccines. Of course, vaccines we probably won't have until a year or 18 months. So, and what we continue to talk about is slowing down this virus so that our medical systems and our public health systems, and as the mayor mentioned, our supply, so that we will be able to maintain until we have some medical interventions.
How many, can you talk to people about how many people they think will be infected with this virus, because it's
Right.
quite a
Right.
few.
Right. So we're talking about here in the United States, a case that began with a few people. Now we have over 1,000 cases in the United States, and we're talking about over 40 deaths with this virus. They are still. I mean, you hear various projections about this virus. I'm waiting still to hear from CDC of what their projections are. I think they're being very cautious and careful in their projections of this virus. But outside the country, we're talking about thousands of people who've perished because of this virus, and we're talking about, like I mentioned, hundreds of countries, over 100 countries that have seen confirmed cases of the coronavirus.
Yeah.
So they've been quite careful with the projection of the number of individuals who might potentially get infected by this virus.
Again, and there's a lot of people, when you're looking at the fatality rate of it, that say, well, we don't really have a good handle on the fatality rate because we're not clear on the denominator.
Right.
We're not clear how many people actually have it.
Absolutely.
So right now that fatality rate's over the number of reported cases, but how many unreported cases are there out there? What I'll tell you is the New York Times, I think, has been doing a really good job following coronavirus. They had a really good in-depth analysis today on a lot of modeling done by CDC. So I'll just share what I read of that article, which was, running these models between 50 and 70%, of the population, of the United States population, getting the coronavirus or COVID-19. I mean, so we're talking, again, a lot of people in this country. Again, we are trying to slow it down, slow the spread, flatten the curve, so we can just elongate this to save more lives.
This is from Ann, can local healthcare organizations manufacture their own tests to help with the shortage?
Well, they can definitely take the samples and send it to the lab where tests are conducted. The CDCs are behind the intelligence of these tests, so they're the ones who are manufacturing these tests, not our local hospitals. They are given the tests from the CDC and from other organizations in order to test the people to see if they have the coronavirus. But they are not manufacturing the tests. They are laboratories where they conduct the testing, they make the tests, but not our hospitals.
So it's kind of the supply chain right now, and the hospitals still need the
Absolutely.
the test kits.
Absolutely. And to relay what the mayor stated about people being tested or not knowing the number of people being tested, and I'm hoping that in the near future that Illinois and other territories or other states in the United States will kind of relax the requirements of testing, because that would give us actually a better picture of how many people have this virus and not really showing any symptoms. So for right now, the people who are being tested are the people who are the most vulnerable, or people more vulnerable, the people who've shown these severe symptoms, or people whom their clinician has taken a look at and say, this is strange, this is an unexplained pneumonia. Let me see if I can get a test for the coronavirus. Once those laws are relaxed, once those requirements are relaxed, where it's available to the entire public, we will get a better picture, like I mentioned, of how many people actually have this coronavirus.
Do we have any idea how many Evanston residents have been tested so far, and is there any projection when large-scale testing will?
Well, right now, I do not have those numbers, and at this time, I can't really tell you when there will be a large-scale testing for the individuals. That's what I'm hoping that will happen soon.
Again, and just so everybody understands, yes, we need more testing kits. We also have so much testing capacity at these labs. We need to bring more labs online. They're working, again, the state and the feds are working to do that. And then there's also agents that they need to run these tests, and they need enough of that supply to run the tests. So there's a lot of moving parts here. But it's a really important question, and people that are focused on testing, that's the right place to be focused on.
Absolutely.
Is the city taking steps, this is from Howard, to help grocery stores and pharmacies stay open through the crisis?
Yes, I talked to Howard about the SBA economic injury loans, the disaster loans. We're going to continue to push so those are available and get the federal government to turn that on. That is right now the only solution that we have available to us. But again, if you've got a suggestion, post it online. We're taking a look at social media.
Yeah, Howard also asked, is it considered safe for a senior citizen to be outside as long as they stay 50 yards away from others?
So as long as they employ the measures that I mentioned in this segment, staying away from crowds, maintaining social distancing, washing hands, not touching your face, your mouth, your nose, as long as these things are employed, people can stay healthy. So that's what we emphasize. We continue to emphasize it. And there's a reason why we continue to emphasize it, because we want people to know the importance of non-pharmaceutical interventions in protecting individuals. So as long as a senior stays away from crowds, and another thing that is very important, take your medicines, eat healthy, drink water, sleep. These are important factors to know, especially with our seniors, in order for them to be strong enough and be able to withstand, hopefully, the virus if they ever hits them.
One more or whatever. This is from Doreen, and I think we know which Doreen this is. She brings a real scientific perspective. She said, should the Library City's Wi-Fi program be expanded to support COVID-19 social distancing?
Doreen, that's a great suggestion.
Yes.
All right, it's a great suggestion. And when I talked earlier at the beginning about we don't know what all the needs are. We don't have all the solutions. We're really looking for a whole community approach to this. That's something that I'm going to take up to the library director and the city manager to look into. Absolutely, because it is an issue if all of a sudden the schools are going to e-learning and there are certain pockets of the community that don't have access, then that's a problem. Yep.
How does a pandemic like this eventually wane? And that's
a very good question. I would say containment, and I will go back to what I stated in the beginning of our session. That's what CDC wanted to do, is to contain it once we heard about this outbreak in China, where they started to conduct, of course, screenings at various airports. But we've passed that stage. Now we're in the mitigation stage. So in order to control or subdue a disease or a virus, containment is important. Another thing are what I mentioned, non-pharmaceutical interventions, where what you're doing is you are not making this virus available, because we are the transporters of this virus, and that's why we recommend 6 feet of distance, because that's what it requires for one to transfer that virus to another person. And if we take the measures that we need to take by staying home when you're sick, the journey of this virus, of course, it won't affect anyone, right? Because you are indoors. Another one would be vaccines. If we have vaccines, it will tremendously help to contain and control or eradicate the virus. But the virus situation is still on the horizon. We're hoping, like as I mentioned, in the maybe next 12 to 18 months that we will have something in the market, something available, so that we can administer individuals and hopefully eradicate the situation. But for me, as I mentioned, containment is one. Staying home when you're not well, by employing these non-pharmaceutical interventions so that the virus doesn't have anywhere to go. And also, if we have any vaccines, I'm hoping in the future that we will.
I'm sure there's plenty of other questions.
Right.
How can people keep this
Yeah.
keep this dialogue going?
Yeah.
Right.
Who do they contact?
That's a great question. So, as part of our approach to this, one big aspect of it is public information and making sure we're sharing things, and you can never probably share enough or share quick enough, but we also want to be thoughtful and we want to be substantive. There's a lot of information coming at people from a lot of different directions. So if people found this helpful, for instance, Bob, this is actually a pretty nice format to be able to communicate a lot of information and really get in depth and answer people's questions. That would be my preference. The reality is we are getting tons of emails. I'm fairly responsive on email, but it's hard these days, honestly. We need our public health director overseeing the operations, not responding to all personal one-on-one questions and things like that. So we'll continue, our public information officer, to monitor questions that come in. We'll put out frequently asked questions so we can try to answer. I think we should continue to do these sessions. Again, we've got the state government, the county government running things. Governor Pritzker has a conference call around 2 o'clock, a press conference around 2 o'clock every day. He is having that. Again, I think that's overkill here in the city of Evanston. We don't need to do that, but we do need to keep communicating. So on the comment section of this or others, give us a sense of how often and frequently you would like to hear from your public health director and others in the city. That would be helpful.
I just wonder, you deal with crisis situations, some of the most, is there a different character to this one than?
I mean, the difference between this one and a lot of the others that I've dealt with in the 25 years of my career is they're more isolated, right? Hurricane Andrew struck southern Florida, north earthquake, southern California. Here we have a nationwide, and so people are getting information, from the national media constantly. This wasn't an event that happened and then it's out of the news. Right. It's out of the news in a week. So that's a difference. But what I would say is that, and everybody's being affected in the country, not just to any particular geographic area. The elements of the response, there's a lot of similarities between response to a hurricane and the response that we're trying to take. There's operations, there's logistics, there's finance, there's communication, and at the state level, the governor issued a disaster declaration at the state level. As I mentioned earlier, the federal government has not issued that yet, and we don't know if they will or not. Again, it's unprecedented because you're going to have to shoot it for the entire country, and the amount of money that would be. Right. But we also are talking about the health of all Americans, and so they've got a tough decision that they're going to have to make. But many of the elements, the unified command structure, the what's called ICS, incident command system. All of that is going to be employed. It's being employed at the state and the county level. If we get to that point here locally, we'll stand up our emergency operation center as well, I imagine.
I know you guys have a lot of things to do.
Yes.
I really want to really thank you, and thank the residents for
Absolutely.
once again coming through with such great questions.
Yes.
And keep tabs, cityofevanston.org. And thank you very much.
Thank you.
All right. Thank you, Bob.
Thank you.